Good morning. This is the great KBC, and you're just in time for KBC News Check, a program that we earmarked to ensure that we keep you afloat on what is happening or the news that are hitting the country. Thank you indeed so much for joining us. My name is Njue. Lenso Dingo is our sign language interpreter? No. All right. And of course, today we are looking at matters, drugs and substance abuse. And I beg your pardon, it's Lucy Mwaura, not Lensa Odingo, on the sign language interpretation. We are looking at drugs and substance abuse in the country. And if you remember, I think it was last month when NACADA released some startling figures in regards to how the drugs and substance abuse are going on in the country, where be it Miraa, be it alcohol, be it cannabis or bang, and also polydrugs, that is multiple drugs. That is a discussion that we'll be having here. And looking at the statistics, we have a problem, but we have the experts right here to help us put those things into perspective. I have a doctor and a professor, and beginning with my immediate left, we have Dr. Rose Kiiru. Dr. Rose Kiiru is a psychologist and also a mental health expert. Karibu sana, Doc.
Thank you.
Just next to her, we have Professor John Muteti. Prof is the acting CEO of NACADA. Prof, karibu sana.
Asante. Good morning.
And maybe to start with you, looking at this report, 15 to 65 years old, I think this is where the gist of the matter is. Unfortunately, talking about 15 years, somebody is quick to notice that this is an underage child. At 15, they're already using drugs. Kindly tell us something about the survey that you released, I think it's sometimes last month.
Thank you, Njue. We do surveys on the prevalence of alcohol and drug abuse in the country. And these are surveys we do nationally, once every 5 years. And these surveys usually give us a feel of the use and the misuse of alcohol and drugs. So this survey, which we released, actually early this month, gave us an indication of how the problem is, how serious the problem is. The problem has always been serious, but it is becoming more serious. And hence the reason why we are really saying that serious interventions must be, sought. And that's why you see even the president, the deputy president are on this issue seriously. Yeah.
And Dr. Kiiru, I'll give you your opening remarks in regards to, it's quite disturbing looking at the ages of those who are hooked onto one or two drugs. And actually, according to Prof, we have seen there's also polydrugs, meaning a blend of a number of drugs. Either somebody's taking alcohol, Miraa, and also bang at the same time. Does it disturb you as not only a doctor, but also looking at the ages that we are looking at?
It does, absolutely. I did my doctoral studies on polydrug use. And what my colleague has said here about polydrug use. In my study, I noted we have patients that I interviewed that were polydrug using 6 drugs, etago.
6?
My study has it.
Wow.
Last year, and that was last year.
6 drugs at the same time?
At the same time.
And what ages were you looking at in your survey?
Okay, my ages was adults over 18 years. But when I now interviewed, that was my inclusion criteria, 18 and above. But as I was going through the clinical record, I noted, although it was not part of my study, that some of the patients that were going through the treatment, because I worked with the patients that were going through the methadone treatment because of using heroin. So for me, the age group that I captured, some started using it 7 years. 7 years, 8 years.
Wow.
So even the age is lower. But we are talking of majority, as he's saying, majority is between that and that age. but the engagement, the trial starts early. Yes.
Prof, I grew up back in the early 80s, and back then we were not seeing this kind of startling figures. Actually, a simple drug as alcohol was a no-go zone for us back then. But looking at what we are looking at now, we are looking at children who are even using at 15, 14, and even in high school, and also some are even starting this, taking drugs when they are in primary schools. What, according to your survey, what is leading to this? Back in the 80s, back in the 90s, and now, quite different when it comes to drug abuse in the country.
Thank you. You know, the age of initiation, when one starts, getting initiated into this drug, use, is alarming. Actually, it is as low as 6 years. At 6 years, we find that some kids are smoking tobacco. At 7 years, you find some kids taking alcohol. So you can imagine, the initiation age is just too alarming. And usually the problem is that the parenting, which used to be there then, may have, is a challenge. The parents are coming home with the beer, they are smoking in the house, and when the kid sees the father, the mother smoking, what message is being sent? That smoking is acceptable. If they come with beer, they put it in the fridge, the kid will start, experimenting. And what moral authority will the parent have to challenge the kid that, smoking is bad, and yet you are the one who is smoking? Actually, smoking in the house. Again, you find that, of course, the peer pressure. If you go to school, you find that their fellow kids, some of them are smoking. They introduce them to such. The internet now, you get all these things, and the influence, as far as the internet is concerned, is adverse. It's not very good. And the kids, now they have access to their mobile phones, so they can get in there and they can see all these things. And then you find that even the online, sale of some of these things, you can buy, a beer or even a cigarette or whatever, you can order it online. So that is actually a challenge. And these are things which we are saying we must really look at them critically, so that we interrogate what should be done, because we need to save our youth, our kids.
Doc, according to NACADA, I'm seeing that minimum age of initiation is getting lower over time, where the age of initiation was 6 years for tobacco, 7 years for alcohol, 8 years for cannabis, 8 years for prescription drugs, 9 years for cat or Miraa, 18 years for heroin, and 20 years for cocaine. All these are kids. And there's a good thing that Professor has observed, that peer pressure when they go to school. And the school has also been a fertile grounds for initiation of some of these young people who are taking these drugs. You are a mental health expert. Can you tell us what this is doing to our young minds back in school?
Thank you so much again. What is happening when these kids take the drugs? Their brain is developing, because a brain of a human being keeps developing until, if you are a female, up to 25 years, if you are male, up to 26 years. So what is happening to the brain of this child who is taking all these substances? It is interfering with the development of the brain. So there is effect on memory, there is effect on concentration, there is effect even on the way they behave. The behavior is also affected, because definitely the brain is also affected. Yes. So all these psychological processes and physiological processes are happening at that young age. And that's why you find these days we have very young people who cannot make a decision, who cannot actually remember. It's affected. But this is against the common belief that when you take something like cannabis, it improves your memory, which is wrong. People need to be told the truth. By the end of it all, it numbs the brain, and you're not able to remember. You experience as you are a different person. Concentration is lost. Decision-making is interfered. Thank you.
Prof, alcohol is one of the most abused drug, not only in the country, but in the rest of the world as well. And the Kenya situation is a little bit dire. I'm saying that because I remember the Deputy President said that, and especially in the Mount Kenya region, people are becoming zombies, and he has started a spirited campaign to ensure that all this, the clubs are always closed and young people do not access alcohol. I would like to take you through that.
Yeah, thank you. Actually, the fact of the matter is that alcohol is not a problem in most parts of the world. It is a problem in Kenya. It's unique because even when we interact internationally, we find that the problem is with the hard drugs, the heroin, you know, the cocaine, the bang. But in Kenya, alcohol seems to be the biggest problem. You know, when you are engaging, you know, with the WHO, they will tell you tobacco. When you are engaging internationally, but in Kenya, the problem is alcohol. And I think the problem is because we have the standards which we are supposed to really, you know, meet are not there. So in Central, for example, we have a problem with the potable spirits. The potable spirits, this is just people coming with ethanol and water and mixing and then making a drink. A very potent drink, which is not regulated, which has no standards, which we don't even know the composition, you know, whatever is put there. So this drink is actually poison. So people are drinking poison. So the moment you drink poison, then you can, as the doctor said, you know the repercussions. The other drinks which are illicit, because we have illicit and licit brews, drinks. The illicit drinks have standards, and even the alcohol contents are known and documented. Inspections are done, and you can say, you know, the process of coming up with such a drinks. And you would find that the volume, as far as the alcohol content is also regulated. So the problem we're having, especially in Central, is the use of those potable spirits, and that's why you can see the impact as far as the levels of you know, addiction are quite you know, serious. We have regions like Western, where the problem is the traditional brews, the busa. Again, busa, you know, may not be as potent as the potable, but still, it's a big problem. Because once you get addicted, you know, you can get addicted with the local brew, with all these others, and the challenge is, once you get addicted, then it is difficult to get yourself out.
All right, and we will still be getting to that. In the meantime, we'll also be looking at how it is affecting the mental health, and especially at homes, because we are finding a lot of fights, a lot of mental illnesses in families that are attributed to usage of news check. And we are looking at drugs, the status of drug and substance use in Kenya in light of a report that was released by NACADA in regards to the drugs that are being used in the country and the age brackets that are using that. And looking at it, it's quite disturbing because we seem to be clawing on some of the gains that we had made a number of years back. Before we went to Kisumu, we were looking at how it is affecting the mental stability and especially the mental faculties of families. We've seen a lot of fights, and especially when we had COVID, A lot was attributed to a lot of people carrying the stuff that they need to use, if it's alcohol, if it's Miraa, because everywhere was closed. And we witnessed a lot of cases of gender-based violence back then. And most of them were attributed to substance abuse.
Thank you so much. I would want to contribute a bit about the use of around drugs, or the drugs that we use. They are drugs because they affect our brain, but they are around, like alcohol, like cigarettes. They have an impact, yes. But these are the gateway drugs. As Prof has said, our young ones admire their fathers, admire their sisters, admire their neighbors when they are taking them. So they experience, they see and observe how they feel good, how they feel high. And this is what informs them on the choice. Then coming to the impact of these drugs. When I talk about gateway drugs, I'm talking about when you get to using like cigarette, you are a likely candidate for cannabis. You are likely candidate for all the other drugs, including heroin, cocaine that is on high use in our country, according to the study I did. What is the impact of use of this at family level and even at the individual level? School level and our community level. That's what you want. So the impact is this. Once we are on drugs, we call them psychoactive drugs, meaning they affect the way your brain works and behaves. Once you are in it, your emotions are likely, you are likely not be able to regulate your emotions. So you are likely to be violent, unlike when you are not using. You are likely not even to make decisions, meaning when you are violent, you can now fight or over. Then there is also the issue of relationship in the families. When somebody is in drugs, one of the greatest impact is the relationship in the family. And this is also what leads to gender-based violence. In terms of maybe the husband is being told that, why are you using this? And that there is no money, there is no food. Then the husband will respond by fighting. So there's a lot of fighting. Parents also are not able to know how to handle this. So they are fighting with the kids, their children who are in drugs. So there's a lot of fight within the families. There's a lot of misunderstanding. The relationships are not okay. To the community also, there's a lot of impact on drugs. There is no productivity because most of these people who take drugs and they are in the addiction level, they don't work. So that's not another great impact. There's no productivity amongst our people. And then what is the impact in the overall government? There's also a lot of money being used to treat the same behavior. Economic wastage, which would have been prevented through advocacy and preventive measures. Thank you.
Prof, I believe whatever the doc has talked about quite resonates. We are looking at a situation where even families are going down the knees because of drug abuse. Alcohol mostly, but there's something that we are putting a lot of emphasis on alcohol. Yes, indeed, a lot of people are abusing alcohol, but there's also cat or Miraa. I happen to come from a region where we have lots and lots of it. I happen to have few stems myself. But looking at how it is also affecting school-going children, a lot have dropped out of school to go into Miraa farming. That I can attest to. And the government is not doing a lot to ensure that these students or these small boys and girls remain in school until they are out of school. They can continue with their farming and stuff, but a lot are dropping out of school. How is NACADA addressing the Miraa challenge that we have, or the cat challenge that we have in the country?
Thank you. You know, Miraa, just like tobacco, just like alcohol, is a legal drug in Kenya. I mean, you know, you cannot be prosecuted because you are taking Miraa, you are chewing Miraa, and it being a legal illicit, substance, what we need to look at is the management, such that there is a regulation for these youth. Is it possible, just as we have done for alcohol, to make sure that if you are below the age of 18, you are not supposed to chew Miraa? Because it's a drug. And also, you see, because of the quick money, which these kids will really go, there's a farm, and their parents' farm, and they will go there and get the money that day, get quick cash. I think that also contributes to the dropout rate, because they would think that, oh, I'm going to get 500 shillings every day, and all that. But I think the solution would be if we involve even the Miraa growing communities and all those people, so that, and even the government agencies, the local, the opinion leaders, the church, and everybody, so that we don't have a situation where children are, used even in the selling of the Miraa. A child who is below the age of 12 cannot sell beer. You can't find them selling beer in the pub. The same case should be with Miraa. Why would a child who is less than 18 selling Miraa? Why are they doing that? So are some of the things we should look at. As far as we are concerned, of course, Miraa has been scheduled by the international, community, as a drug. But as a government, as I said, just like tobacco, we take it as a illicit drug, and therefore we should come up with ways of managing, because it is also addictive. It's addictive. And studies have shown that, it is addictive. And I would imagine that if we do proper engagement, because also there are people who are, their level is on Miraa. And if you are telling them today, no, this one is no longer wanted or whatever, what will you do? You have any alternatives? Alternative levels, do you have? We don't, for now, but they can be found.
And there are other emerging drugs that, looking at 5-10 years ago, they weren't quite absorbed in the country as they are now. I'm talking about alternatives for tobacco. We've had, a couple of years back, we had a product called Lift, where you put in one of your gums and it causes some electricity or something. But now, looking at 5-10 years ago, that is something that we should have done and dusted with, because at the end of the day, they are also contributing to the drug use in the country. There's also shisha, which was banned, but unfortunately we are seeing it back, and it's and I'm quite sure. You see, Prof is laughing because he knows that it's also a big challenge in the country. These alternative sources, they are legal, because if you look at, if at all there is a product that you can buy, I quite believe that it is legal. Looking at shisha, we go to one of those pubs in Kilimani and up and estate, and you will find them. And in estates like Eastleigh, this is also providing a challenge, a bigger challenge to an already compounded challenge. Dr.
True. There are many drugs that have come on board, and some of them are the ones we are calling the new psychoactive drugs, under the classification of the prescription drugs. The drugs that are prescribed at hospital, they are the ones that our young ones and even old ones are using. And many others that are not even documented. Because when somebody is in high, when you want to feel high, they look for anything. And that's why new drugs will keep coming. They look for anything that will make them high. Like when you are used to shisha or tobacco, it will reach to a time when it will no longer have effect on you. So you will start now
to step it up again.
Yeah, stepping up by in bringing another one, so that you can still feel high. Like the people that I said they are using the 6 as a cocktail. They started with cannabis, and then they feel they're not feeling high. They add another like benzodiazepam. Then they go adding another like heroin. They go, then they even put, we call it cocaine. Then you find they also put those scissors and all that. And then they also use, I am telling you, is a whole risk. And all these drugs are available in Kenya. The demand and the supply is very high. Why? Because our people who are in the drugs, they are ready to continue feeling high. They are committed. And that's why the supply is there. So something requires to be done very, very urgently to address the situation. As Prof have said, it's going up day by day. And it's reaching to an uncontrollable level. You talked about when we were young, there were not these things. We never used to take drugs. Yes, because we had some control. We never used to have kids take drugs. Alcohol was being taken by adults, cigarette by adults. But today, you find a child of 8 years, 9 years, smoking cannabis and cigarette, gateway drugs. And that one is now a candidate for heroin, a candidate for cocaine. Then, from an expert point of view, anybody who have used drugs before age 21 is very, very difficult to win them. We win them, but it becomes more difficult to win them from the same. Unlike somebody who has taken above 21 years. The brain has actually matured, is almost reaching the maximum level, so it may not have much interference. You realize that when we take them for treatment, they recover faster than the young ones who started when they were young. So there is a lot of advocacy that is needed, that need to be done, that the earlier you start taking these drugs, the more you are likely not to be treated and recover smoothly. Because the brain is already growing, having this psychoactive in it. So people require to be aware, people require to be educated. So that all of us, we can guard against our children using these drugs. Yes.
Prof, in your report, there is a polydrugs or multiple drugs, and the prevalence is 6.5, population affected 1,766,583. Can you tell us something about this? Because this seems to be an emerging trend that, if not checked, we would be having a number of issues.
Yeah, like what Dr. is saying, when we are talking of polydrugs, we are talking of use of multiple drugs. For example, you are smoking and you are using beer. You know, you are using cannabis and you are also using cocaine. You are using heroin and you are using other kinds of drugs. And this is far much more serious. If using one drug is serious, what about using many drugs at once, concurrently? So this is a situation we picked up during our survey, and you can imagine at 6.5%, with a population of more than 1.7 million Kenyans having this problem with the polydrugs, it is really a dire situation. Maybe let me mention something about shisha. Shisha is not legal in Kenya. The Ministry of Health, through a gazette notice, outlawed shisha. And the reason was informed by a survey which was done by NACADA. And that survey showed that shisha is being laced with heroin, with cocaine, with marijuana, and with some other hard drugs. So you think you are smoking the shisha, but then so that they can get you hooked, because once you are hooked, you come again and again. So that they get you hooked, they will lace it with something which will be addictive, and that is the samples which were taken showed that quite a number of these shisha outlets are lacing these drugs. I mean, these shisha with hard drugs.
That is the current situation we are in.
Yeah.
All right, Doc, looking at what we are currently going through, there's also those people who are hooked we are trying to help, and especially it's in your line. mostly it's because of the makali, the portable spirits Prof talked about in the Mount Kenya and Central region. And looking at the stigma that is there for these people, the society views them as ule jamaa anashindanga kunywa kulewa, you know. There's very, very, very little sympathy from the community so as to help these people. And even family members, there are some of the family members who shun these people. This is not the way we should go if we are about to help anybody who is addicted, and so that we may change these figures.
True. Most of them, when they seek help, even to the family, from the family members, they don't get. It reaches to a time when you start using drug, you use alone, and you hide. But when it reaches to addiction level, everybody in the family is involved, because for one, you affect everybody. Either you'll be stealing from them, you'll be fighting them, you'll be fighting the neighbor. So it becomes a concern of the immediate family and also the neighborhood. And then, because of that, the user is again now stigmatized in a way that you are feared. It's your choice, you know, it's your choice that you decided to be taking, you know. There's that blaming. Yes, then they also bring in, then they package it that you have become psych. Because we have what we call psychosis induced through, because of the drugs, especially when you're taking drugs and it's not in your system. We behave just like that person who is psyched, induced psychosis because of substance. So it means people look at you like you are psych, and they package it like that. So when these people try to seek help, they don't get. One, you have stolen from them. One, you have beaten them. So they have no sympathy. They have no mercy with you. They are not ready to help you. They suffer a lot. And that's why when you get to this population and they find that you are able to mingle with them and you understand them, most of them are ready. They are ready to listen. They feel heard. They feel loved. And they are ready to get out of it. Why? Once you get to the addiction level, it's not you who decide that you are going to take drugs or whatever you are taking. It's the body that tells you it is time. I need it in the body. So there's no control. And this is why they are blamed a lot. Where they are helpless. Some of them are even prayed by the family members. Some of them are even talked to by the family members. It cannot work. This person requires to be weaned off the drug that's already in the system. And then the praying and the talking can get in.
What are some of the strategies? You want to add something on that?
I want to add something to what Dr. is saying. Actually, addiction is a disease. These are people who are sick. And I think if you stigmatize them, it's not going, it just adds up to the problem. And I think Kenyans should understand that addiction, just like malaria, is a disease. When you are sick, do we stigmatize you because you have malaria?
No.
Or when you are sick, do we sack you from your job?
No.
The right way is to help these people. And you know, thank God, addiction it can be treated, you know, and it can be managed. And therefore, the right way to go about it is to make sure that these people get the proper treatment and you know, the aftercare, you know, after that. And we most importantly, we integrate them in the community, so that once you know they are cured, so that the relapse, because there's a lot of the relapse rates, you know, are quite high, and there are reasons why they are high. You know, it's because this person goes to the rehab and they come back to the society. There's nothing to do. They are just you know around there doing nothing. You know, lazing around. What do you expect them to do? You know, they get back to the same you know, problem, the same peer pressure. And so if these people can get a way out in terms of getting them something to do, you know, I think we can improve the relapse rates.
Sure.
And what are some of the strategies that you are employing after this report? There are some things that you noted that should be done, and as NACADA, you have the mandate to do them. What did you deduce from the report, and what are some of the mitigating factors that you are undertaking?
We, of course, after looking through the report and after making analysis, we have realized that this problem must be solved, from different levels. One, the schools, because you've seen the initiation, 6 years, 7 years, 8 years. So the intervention must start from the schools, the primary schools, the secondary schools, and so on, so that we can empower these kids early enough. If a kid is empowered to say no to something, in life skills, for example, would empower a kid to, if you want to try and give a kid a cigarette, they will be confident enough to say no, this is not right. So we need to infuse such life skills to our kids. And this is a program which would be very critical, and we work with the Ministry of Education so that in the curricula, the life skills is part of the curricula. So that's one of the most important interventions we are doing. Of course, in the workplace, we realize that depending on, some people have got disposable income, high disposable income, and you find that even in the workplace, this is a big problem. So again, we have programs which we urge the employers to to apply, so that their employees, you get to know the dangers of ADA, and those who are affected can be supported. So those are programs in the workplace.
Okay, just hold on. Just in case you joined us, this is KBC News Check, and we are looking at drug and substance abuse in the wake of NACADA releasing a report that shows quite dire statistics in regards to the drugs and substance abuse in Kenya. And actually, we're trying to put things into perspective here with my two panelists, that is Dr. Rose Kiiru on my immediate left, and we also have Professor John Muteti, who is the acting CEO of NACADA. For questions, suggestions, or even where you are watching us from, kindly hit us on our social media platforms. Back to our live discussion, we are looking at some of the mitigating factors that you have had to undertake in the wake of these startling figures. And more or less, it shows that we are talking about millions of people who are hooked on to drugs and substance abuse. And actually now the polydrugs is actually making the situation a little bit more dire. I'm saying this because if I'm trying to get out of alcohol, and I'm still using cannabis, and I'm still using shisha, I'm still using tobacco, then it becomes a little bit harder for somebody like me to be helped or to get assistance. Prof. Yeah,
that's why we were talking about the programs which we are undertaking currently. I've mentioned the school programs, the workplace programs, the community-based programs. This is where we want to bring in the aspect of, the positive parenting. The positive parenting, where we are telling parents that it is your responsibility to ensure that your kid is brought up with the right, morals, with the, right information. And this positive parenting actually would help a lot. That's why I'm saying, why would a parent go with the beer or a cigarette in their homes? Maybe they don't have the right information. If we really talk to them, I think that would help. We are also talking to the borders, the matatus, and all those people where, they interact with our kids. Because if we talk to them, then nobody's going to smoke in the matatu, and even they will help us, even, in this fight against alcohol and drug abuse. But the greatest, in my opinion, and actually in the opinion of the NACADA, this war cannot be won if the community is not involved. It is the community now to take charge, Somebody is seated in the boardroom will have theories or whatever, but those will just be theories. We will go to the communities and empower communities to bring the fight up to that, grassroots level. So that if they see somebody selling an illegal drug, if they see somebody selling these portable spirits which are poison, they can, intervene. We empower them so that they can say no. Interestingly, these people who are selling some of these illicits are very innovative. They are very innovative. So they know that they will not sell them in premises which are known, which are licensed. So during they will now stage manage funeral meetings, and you think it's a funeral meeting, but it is these guys selling these illicits. They will stage manage a pre-wedding, and they go to somebody's homestead. They will, and they have been doing it. And actually, studies have shown that intelligence has shown that these people are now being very, very innovative. So we are saying that we must find ways of getting these people. And I am just wondering, because the chiefs and assistant chiefs are there, and they should be getting this intelligence. And the president the other day directed that the Nyumba Kumi should be actively involved in this, because you're talking of Nyumba Kumi, you are talking of the lowest grassroots level. And if the lowest grassroots level of leadership is involved, then we will make a great impact. And just to add that what we have done is that we have come up with what we are calling framework for community engagement in the management of ADA, and we have already come up with, the guidelines are already in place, where we are now telling the communities, this is the way to engage, this is the way we want you to engage. Come into groups, and these groups will be empowered so that they can now take charge as far as this fight is concerned. Not forgetting also the faith-based organizations, because these are our moral, they are the people who would really tell us, what is right and what is wrong. So the faith-based organizations will also be key into this fight, because they are the ones who are meeting with these kids every week in church and in such other forums.
Yes, I totally concur, and it could be something else, or something quite hard when it comes to policing people so as not to be using drugs and substance abuse, having people doing some sort of a pre-wedding, or actually the borders. The borders are being used for all evils and good as well, because some of the alcohol, some of the drugs are being ferried using the borders. And it's a good thing that Prof has talked about, is that involving the community and the society, because if at all somebody can be flagged because of transporting a substance, then I'm quite sure a lot of people can be flagged for engaging in these kind of illegal trades that are actually contributing to our addiction. Doc?
Yes, I quite agree with the Prof what he has said, that we require to involve everybody. And for me, I would want to start by asking, why do our children start taking drugs? Even before we go to the involvement. Why? What drives taking drugs? And I want to highlight a few things that inform that. One, in the family setup, there's a lot of distress. Parents are fighting with each other. Children are experiencing physical fights. There is a lot of murdering within the youth within the family. There is a lot of harassment even in the running institution, in the community. So when these young ones are exposed to this kind of anxiety and distress, they look for ways of managing that from a psychological perspective. And one of the ways that they fight for numbing that pain is through the drugs. So I wish to concur what he's saying, that we go to the family level and we inform the families the impact of the distress within the family level that impacts on the young one. We are talking of trauma experience within the family. When children witness parents fighting, they seek drugs when they get to know that there's something that can numb that pain. So there's the issue of physical fight that causes trauma on our children. There's the issue of parents themselves fighting the children. So they grow up when they are traumatized. They grow up looking for something that can make them feel calm. And one of the things that can calm the young ones and anybody else is drugs. Even as adults, when you have distress at the workplace, when you are sacked, something happens, you realize that somebody goes to the use. Why? Because you are not calm with yourself. So for me, I would like us to engage a strategy that educates from the family level how this is influencing the youth, so that we don't wait towards the other end of treatment. We cannot alter these people, but we can prevent at that low level. The other thing that is affecting the youth within our people, and especially the young ones between age 11 to 19 years, is identity issue. You realize in our country we have so many children who cannot tell you who their father is. And because of that pain, that child grows up with that pain, psychological pain. I hear the others, they have their fathers. They ask their parents, who is my father? These parents hide, and to them it's not an issue. While it's a huge issue on this child. And all what they need is disclosure, so that they can come to closure of the reality on the ground. Lack of identity is influencing so much on our young ones. The study that I did, as he has said, on drug use, it came out very, very clearly that most of our kids get into heroin not knowing. Cigarette is raised with heroin. So by the time this child knows I was not smoking heroin, and heroin is very potent, within 4 days in your system, you start craving for it.
4 days?
4 days. 4 days you are already in it. And let me tell you, this is sad. I interviewed about 120 patients with drug use, and they had all one common denominator. I didn't know that I would take heroin. I started by cigarette. I started by alcohol. A friend some of them are even initiated without knowing. So the issue of now we are talking about how do we prevent, how do we arrest this? Creating awareness of our children, the people they relate with. Because the very minute this child smokes cigarettes, get into that cigarette chain, already now, even like sip alcohol, you are already now joining the category of users. And there's no coming back. Because the very minute you get into that tunnel, is going forward. You'll be put something that's making you feel high, and you reach a time you cannot come back. Not unless people like us come and help you. Where we do the detoxification, and then you stabilize, and then we engage you.
And actually, that's even harder than even getting into the drug itself.
Yes.
All right. Professor, when we come back, we'll be looking at some of also the role that NACADA can play to actually assist us Kenyans, because looking at these numbers, they really need to change. And also we'll be looking at some of the strategies you can employ yourself as a Kenyan to ensure that we do not sink deeper into the drug menace in the country. And also you'll be telling us about the prescription drugs. They are becoming very, very famous with people who are abusing drugs. We'll be knowing exactly why are people resorting to medically proven drugs to actually get high themselves. We'll be back with this discussion in a short while. Welcome back to News Check, and we are still continuing with the topic of discussion today, where we are looking at the status of drugs and substance abuse and use in Kenya after NACADA a couple of days ago released this report, which, if you look at it keenly, it's quite disturbing when you look at the ages of people who are using drugs in the country. And now we even have a bigger problem when we have polydrugs or multiple drugs, and to get out of that is quite something. And also another emerging issue is on the prescription drugs. People are using the prescription drugs, which are supposed to be curing your body, to get high. And Doc, here, it's a good thing that you did research on that. Tell us the status of prescription drugs in the country. And I'm quite sure if somebody hears that prescription drugs, you cannot just buy them over the counter, but they are being sold over the counter. This is something that the government needs to reel in and nab before it becomes something out that cannot be controlled.
Prescription drugs are not being sold in the counter. Mm-hmm. The people who buy them for abuse, mm-hmm, they buy them from the black market. It is purely circulating in the black market. Mm-hmm. And it's high. The use is high. Among all the patients that I interviewed, they were using prescription drugs.
Which drugs are we talking about? A case in point.
Benzodiazepam.
Mm-hmm. We're talking about syrup, injection.
We are talking about
tablets.
It depends with the form. We have the solid. Mm-hmm. We have now the liquid, mm-hmm, and also the liquid and the solid. Yes. So it depends with the form that it comes. But mm-hmm, the bottom line is a psychoactive drug, mm-hmm, and it's not supposed to be used for other use apart from prescription. That's why we are saying misuse or abuse of prescription drugs. These drugs are available in our hospitals. Mm-hmm. They are available in chemists. They are available in the black market. Why is the use of prescription drug up? One, something like cocaine and heroin. Heroin or cocaine, let me talk about heroin because I dealt with heroin population. Mm-hmm. Heroin, one sachet goes for 200 or 150, depending on where you buy. But when you buy a prescription drug, you get it at 10 shillings.
10 shillings?
10 shillings. And I'm telling you, I had clients that were taking about 20 of them in a day. 20 in a day. And these drugs are meant to treat psychiatric disorders. But they have discovered when they use these drugs, is able either to bring them high or to bring them low. By the way, the effect of drug on person is individual. We can take the same drug, you go up and I go down.
Okay.
Yes. So it is the user that says, what is the effect that it has in the system? Mm-hmm. I may be using it to stimulate and use yet the same to depress. Mm-hmm. And again we say, when you take a drug, you go high, and what goes up comes down. So a stimulant will, by the end of the day, make that user depressed. And again, we will look for something to bring the same brain up. Mm-hmm. Then also the impact in our system is very different. We may be taking, and this is what perpetuates the use. We may be taking the drugs and I don't have any effect. But you get hooked, and you get lost. Mm-hmm. So the prescription drugs is high. The government needs to come up with a system of regulating that. I don't know how, but it is in the black market. Mm-hmm. And it is a booming business. Booming business.
Prof, I would like you also to weigh in on the prescription drugs. In your research and in your survey, did you find this as an alarming case of use of prescription drugs?
Yeah. Our survey found that at least 0.2% of the population is using prescription drugs. Mm-hmm. But the challenge is the primary schools, the secondary school kids, in their survey found that they are going up to 7%. Now the question is, why are these primary school kids using these drugs? Why are the secondary school kids using these drugs? That is the challenge, and I think the carrier said because 10 bob, and they make them high, they are cheap, and they make them high. And I think the challenge would be there must be some leakage. Because you are supposed to get a prescription so that you can get a drug. So, and I'm not sure the doctors are giving these prescriptions. So somebody must be, getting these drugs very cheap, 10 bob, 20 bob. So there must be some leakage, in the pharmaceutical, the pharmacies and so on, which now must be addressed because, as the doctor is saying, you get hooked and, it makes them, maybe they feel calm, they are under stress, and then you are taking such a number every day, then you get hooked. It becomes a big problem.
And Doc, in your survey, those people who want to actually be sober, is this the people who are mostly using alcohol, prescription drugs, cat, bang, or who are so much hooked that they want to get out?
Those people who are we have 4 levels of addiction. One is when you're experimenting, so you have no issue, you're just testing, you are just experimenting, there is the regular. There is also the highest level is the addiction. When you are in the addiction level, all of them desire to get helped. Why do they desire? Because they also realize that they are no longer going to use drugs because they want. A compelling force is forcing them to use it. So they feel enslaved and helpless. So for me, I would say the addiction level is the one that desires most. These other ones who are experimenting, they're just saying, "Why? I think it's okay. It's going to be okay." Those ones who use because, like, when you go to the traditional settings or activities, people drink. But then when you become a regular user, this one it starts hitting you. When you cannot sleep in a day without taking 6 beers and that. So you are now moving to the addiction, the pipe that I told you. When everybody in the addiction is crying for help. And when they are crying for help, this is when the family members are not there. Because one, it has caused a lot of distress within the same family. Mothers have been beaten by their own children. They have stolen everybody. They have stolen the neighbors and all that. So you realize that nobody wants this person. And this when they are crying for help. This when they are crying for help.
Prof, there are some of the possible mitigation and way forward of bringing the consumption of drugs in the country. And one of the key issues, as NACADA you pointed out, is school programs that you mentioned, workplace programs. This has caught my eye because looking at a lot of companies and a lot of institutions do not regularly talk to their staff regarding drugs and substance abuse, and they just leave it at just like and leave it out for anybody. Maybe if at all an organization comes along, fine, but themselves as an institution do not participate in workplace programs. I would like you to touch on that.
Thank you. Actually, that is very important. What we have done is that we have now come up with a program, a curriculum of some sort, where we can now take both the employer and the employees through what would happen if somebody has got alcohol and drug abuse problem in their workplace, and how they can be helped, and how, the interventions which can be taken. And we have started with the public sector institutions, where now it is mandatory for public sector institutions to come up with the ADA committees, alcohol and drug abuse committees, where they would identify a problem, and then there is a procedure to follow until this person is given help. And I think that has helped a lot. That has seen a positive impact. on the police, because if the employee is addicted, I mean, if the employee is sick, their output in the workplace is affected. And if it's affected, of course, the Kenyan economy will be affected. We also seen some private institutions coming to us and asking for help, because at the end of the day, ideally, an institution should come up with a policy. After you have all this, then you should have a policy on how to handle the ADA problem, so that you do not have people taking drugs in the workplace, taking beers in the workplace. You don't have people smoking in the workplace, and if they have to smoke, then they have to do it in designated areas and maybe away from the office. So we have such a programs in place, and we have such a curriculum in place, and even we are ready to help institutions, both public and private, come up with the policies to support their workplace.
Doc, maybe you can also add on that, because I remember back in the 80s we used to see a lot of campaigns, the road safety campaigns. We also had the AIDS one, where you found a lot of stickers in schools everywhere, let's help crush AIDS and everything. I believe this is one of the issues that we can revert back to in terms of campaigns to ensure that we get rid of this menace before it swallows us all.
Yes, that's very true.
Because at the end of the day, even if you're not using, you're affected in one way or the other, either by a family member or even a colleague at work.
You are affected seriously, because when a colleague is taking, is in addiction level, you work for them, because no other employee will be employed immediately. So that's a burden to the colleagues. At home, when you're stealing the finances that are supposed to go to the family. When they keep taking you to the rehabilitation, another treatment, you are taking the limited finances within your family. So it's affecting all of us. And a serious campaign required to be engaged, so that at least we can bring this one to a manageable level. I talk about, and I want to agree with Prof, the issue of prescription drugs. You put them in the pocket. We are used to having drugs in our pocket. So you'll find that a child, like during the COVID time, would be at home, and by the end of the day, the parent talks to this child and you are not communicating, just because the child is taking the drug. It's already packed in the pocket. And with my study also, I realized that some even stopped taking heroin and all that. They are only doing the prescription only. So we require a very spirited campaign for parents and everybody to be aware that not the drugs that are being used by our people, they are not just for medical use. Yeah, physiological treatment, they are for abuse. We require to be aware. Come to the medical setting. In my study, I had doctors and nurses who are addicted. And where do they get their supply? In the hospital. In the hospital.
Yeah, that's a big issue. We have sick doctors.
Those nurses, yes, a whole trained doctor. Addiction can affect everybody. You realize that when you go to the hospital, we have the pethidine. The pethidine, we have like the morphine. These medications are, even like tramadol you talked about, they are used to treat pain. And especially the people who are suffering from chronic illnesses like the cancer. But we have doctors who are stealing this medication from
the hospital.
From the hospital. And there's one nurse who told me, Daktari, if you ever have a space anywhere, can you talk about nurses and doctors using patients' medication for themselves? Your patient is groaning there in pain, and somebody has taken that medication. Then even this supply that you find out there is also from the hospital. Maybe I bought for your patient, and then I take it because it's about money. It's about money. But for me, as I sit here, I'm not fighting the supplier. Why? You don't go for something that you don't need. There are many things that are being sold, and you don't buy. Why don't you buy? Because you don't need, you don't have value for it. We need to work on our people so that they can make informed choices as they go to buy. Because if there was no demand, there will be no supply. What is causing this demand? We should address that.
All right, and still on addressing issues, as you add on that, looking at NACADA, I think you should be having prosecution powers, because we know very well a lot of Busa, we know Western. If you talk about a lot of these second, third generation drinks, we know Central and Mount Kenya. If we talk about Bangi, we know a lot of it is coming in from the north of Kenya. When we talk about cocaine, heroin, a lot is coming from the coast. Basically, we know where the issue is, but we are not tackling it. But hold the thought. We are back in our discussion where we're talking about drugs and substance abuse in the country. And this is coming in the wake of NACADA releasing a report, a startling report in regards to how drugs are infiltrated, not only our cultures, I mean, infiltrated us, and also prescriptions drug becoming one of the key dangers that we are looking at when it comes to substance use and also addiction. Coming back to our discussion, we talked about one of the possible mitigation and way to bring forward is we were looking at workplace programs. And Professor, you had talked about and said that this would be quite a noble gesture if at all organizations and institutions can embrace this, because a lot of people are using substances and also affecting work. Community-based programs. We've seen NACADA not once, not twice, talk about how drugs, the proliferation in the country has been. Before we went for the break, I was telling you we have a clue, a big idea of where all these substances are coming from, but unfortunately we are not sealing those loopholes. We're talking about, when we talk about cocaine and heroin, it has been more or less associated with the coastal counties. When we talk about Busa and talk about the second generation drinks, we know about Central, and even the president raised the red flag on the same, and the deputy president is working every day to ensure that we get rid of this. When we talk about bang or marijuana, we know there is quite a porous border when you talk about the northern Kenya. As NACADA, do you believe that you should be given more mandate and more teeth to bite so that we may be able to rid of this?
Thank you. You know, as NACADA is a government institution, and as a government institution, we work as you know, we use what we call a multi-agency approach to working, where we are working with the police, we are working with the KEBS, we are working with KRA, we are working with the counterfeit, we are working with public health officers. Because, you see, for example, I'll give an example. When you talk of alcohol, you see, if for that alcohol to be declared, you know, illicit or safe, then it must have KEBS, you know, certification, as I told you. It must also have paid taxes. That's where KRA comes in. It must be served in an hygiene place. That's where the public health officers will come. And therefore, all these, you know, players, you know, government institutions, which are there to make sure that what you consume at the end of the day is safe. Now, NACADA will look at some technical issues like the labeling, you know, is the label right? Because there are regulations on the labeling. Then we also look at the licensing. Are you licensed? Because our act gives us the power. The licensing is done by the county governments, but we can, you know, we as a national government institution can, you know, are mandated to make sure that the license, as you sell, you know, you have a license in place. Now, what I think should be the case is that we would want to adopt a situation like that of public health officers, where our officers are made authorized officers. You know, authorized officers are persons who may walk into an establishment and find that something is not right, and then from there they can usually take action. You don't have to go there with police, you know, but then after that, then of course there is now the process of making sure that these people are prosecuted and so on and so forth. So actually the first step would be to make sure that these officers are authorized officers. They can bond, they can give you a charge sheet saying that we found that you are open during, you know, these hours, which is not right. We found that you are operating without a license. You know, that is the first stage as we now, explore other ways. You know, as NACADA, we are dealing with not just the supply suppression, we are also looking at the demand situation. The supply suppression is where we are saying that we don't want most of these products to be available, especially the illicits. The illicits. And for your information, actually, a few years back, Kenya was just a transit for these heroin and cocaine. There was just a transit.
Yes.
Very few used to get into the market. But studies have shown that now Kenya is actually become a destination. It's a market. They found a big market where, the drugs will come in and they are consumed within. Yeah.
And you believe that maybe if at all the multi-sectoral agency approach that you're talking about, because a lot of Kenyans will feel that, a very practical example you've talked about, we used to be a transit, now we are a destination. And we know very well that we know the holes, where the holes are. Do you believe the multi-sectoral approach is working? Because if at all we are now transiting to even being a destination for drugs, then it means that that approach is not working.
I wouldn't say it's not working. What is happening is that these people are becoming very innovative, as I say. So you see, and now we must look for ways of being ahead, because they are the ones who are now ahead of us. Because you would find a drug which was never there in the market, you find it in the market. Then you wonder, how did this one get in? Of course, you can't rule out they connive with the security, whatever, so the police, with whoever is in charge. And then, of course, they will look the other way as the drugs come in. But even then, we should be able to anticipate what these people are up to. And even when the drugs are in, we still have government officers, we still have all these people. That's the other day, the DP was telling the chiefs and the assistant chiefs that they will not coexist. If you are a chief or an assistant chief in a particular village, how then are there drugs? How then are there? Then they will not be able to coexist if they are really serious. And I think they must take that a warning from the DP very seriously, because as you can see, the DP is very serious in this matter, and I can assure you that it will be either them or the drugs, either the drugs and the illicits out, or them.
Yeah, Doc, we're looking at a situation where everything is evolving, including what we are using, because during my time when I was a little boy, I never saw any shisha, but now I'm seeing them everywhere. I never saw any digital cigarettes. I don't remember how they are called, but I would call them digital cigarettes.
Yes, you puff.
They also have the nicotine pouches.
Yes. Yeah.
This is a new way.
Yes.
Oh yeah. Okay. My director informs me it's called a vape. Yeah.
Yes. Vape.
The vape and the nicotine pouches. This is a whole new, if you ask me, digital drug center that we are using, and our young ones are still watching us use these things.
Yes.
And unfortunately, they are legal in the country. How can we be talking about ensuring that our young people do not get into drugs, and yet we have this and we have legalized them?
Thank you. Before I answer your question, I would wish to respond to what Prof has said. I said that addiction affects everybody. Much as you are in security does not mean you are not suffering from addiction. I've heard of people who are in security and they are suffering from addiction. Chiefs, in my treatment experience, I've treated so many chiefs. The same chief who is supposed to oversee that the alcohol is not being sold is addicted themselves. The security we are talking about here, this is the reality on the ground. The security we are talking about here, they are also users, and they are innate free. So we require to develop an approach that either those in authority are talked to, or I don't know, the government will be able to know how to address that. But the reality on the ground is that the people who are supposed to oversee non-use, non-spread, they are the ones in it. But I'm not saying all, some. Then you have talked about how do we go reducing the use in our families. The same thing. Parents, the father, the mother, they are users. We never used to have women drink. These days they are worse. When we talk of people who are suffering from addiction, women number is going up every day. So the Kenyan child is at risk. And the Kenyan child is in an environment where he is predisposed to the use. And the availability is very near. We talk of drugs and we imagine drugs are not far. Let me tell you, here we are, I will not move few meters without getting a drug. Here, where I'm seated. Just out here. There's huge market all over. The users nowhere. All right? And for me, my concern as I talk to this station today is how do we arrest that beautiful mind from child level? How do we arrest that? To make informed choices of to use or not to use. Because the fight against drug is a huge fight. It involves money, all right? And where the money is involved, and there is a user. And one thing I want to make it clear, there is nobody who buy drugs through force. It is willing buyer,
willing seller,
and willing seller. So it's a clean business. The question that we need to ask ourselves, why do the user go to buy? Why? What informed them their use? So that we can arrest that. When we arrest that, then the using will not be there, is it? This prevalence will come down. So we require to ask ourselves at the grassroots level, what do we do to minimize the prevalence? Because as Prof have said, the prevalence is going high and high and high every day. And not unless something is done, we are still going to that high level. So we need to address this menace of drugs.
I'm going to toss the same question back to you, Prof, in terms of how we have evolved to use other things. What we are using now was not being used 10, 15 years ago. And you're talking about fighting and reducing the preference of drugs in the country, the vapes themselves. You talked about shisha being illegal, but we are still seeing it. And this is something that I believe NACADA should be quite tough on. And we're having the nicotine pouches. We're also having, a lot has changed in terms of how the drugs that are being used in the society. And the worst thing is that the young ones, the young people, the age bracket, 15 and above, are seeing this and are using this as well. You believe we're quite fighting the drug menace?
Yeah, let me tell you something. Let me say something. You know, we have such a thing as designer drugs. Drugs which are made at the lab, you know, the designer drugs. Yeah, you know, synthetic. You go there and make a drug. And then you can sell that drug online, or you can use what we are calling the dark net. You know, you can buy it. Our kids can access this. They know, they know better than, they are more informed than we think we are. So, you know, you may be sitting with your kid, you know, in a sitting room there, and what they are doing you are not aware of. Maybe they're even ordering a drug through those dark nets and things like that. So that issue of online, you know, sale of drugs, and, you know, I think we really need to be very attentive to, so that we also monitor what our kids are doing online. You know, you are there, the kid is on the phone, you know, what do you think they are doing? You think they are chatting with their friends, but they may be doing far much more, you know, dangerous things. And, you know, there are a lot of myths, a lot of misconception, a lot of misinformation about these things in the internet. And these misconceptions and myths are the ones actually which have, for example, seen the spike in the use of cannabis in Kenya. Our study shows that the use of cannabis, especially the age of 24 years, you know, and over, you know, as it has gone up. These are university students actually, and this is, I would attribute this to the myths that, you know, and maybe from some politicians or from whoever, or even from whatever, that, you know, if you use cannabis, something can improve something, or other people are doing it, and it can. So these are also some of the things we must address and get the record straight.
I also wish to top on that, because you had asked me that question. Where do we have new ones and they are being used? I want to put it clearly here from an expert point of view, that when you use a drug, there is what we call the tolerance. You have been using this kind of a drug, your body develops tolerance. So it never gives you the high that you want. This new drug that comes in, it targets different synapses. You know, in our brain, it targets certain part of the brain. Let me say that for the general public. I don't want to be more scientific. Then where it touches, the drugs that were being used before were not touching there. So this one comes with another
new
high.
thrill.
And you know, every drug user wants that high, the high. So this new one comes and hits in a spot where all the others were. That's why we'll have to continue having new drugs. Because even the manufacturers, as we are here, they are seated in the lab, trying to come up with something new that will hit a different channel, that will open to the brain. Because a drug can never be a psychoactive drug if it does not pass what we call the brain membrane. It must hit the brain. Otherwise, it's not a psychoactive drug. You will not get the pressure of using it. So as we are here, they are also on the lab, looking for that. So that now they bring a new one. And again, the human nature of discovery. You know, I'm not feeling good with this one, I want to change. When they change, they feel okay. Then they start using memory, and then they hit the maximum. A new drug comes. And that's why they keep changing from this to this. As he said, you stop using cannabis, use this. When I was doing my study with 120 participants, I realized that some of them stopped using heroin, some of them stopped using like cocaine, some of them stopped using like alcohol, but they started using these psychoactive, the prescription drugs.
The new ones now.
The new ones now. So you have worked very closely with this one, has stopped this. But because there is that company, there is also that feeling of that group affiliation, that feeling good. Their brain are used to feeling good. So they are in search for feeling good. But with good motivation interview, with good intervention, with the right clinician, it's doable. Because in my study that I did, because I did an intervention study, I had patients that stopped and reduced. I had the success case of stoppage and also reduction. And I left them, and I'll go there to review. So it's doable to be weaned off drugs.
And looking at the comments, Phyllis said vendors are in government. Unfortunately, some officials who are working for government making an environment conducive for drugs proliferation in the country. I was during the break. I remember I asked you, Prof, in Kenya, as in the region, how are we doing in the region? And you said we are a little bit higher than our friends because our friends from Uganda, Tanzania. First things first, Miraa is not quite legal there, and their borders, they do not share a border with Somalia, they don't share a border with the north there, Ethiopia, because a lot of cannabis has been said to be crossing in from the north. How are we doing in relations to our neighbors? Because at the end of the day, they are also our neighbors, could be also be contributing to what we are having as a country, where we are having a lot of a proliferation of drugs in the country.
Thank you. You know, I wouldn't want to accuse our neighbors, but I would want to put the facts right. As they are. Yes. I mean, we really must speak the truth. A lot of bank coming to Kenya is from Ethiopia. And there is a route which is used to bring, and you can imagine, because the borders are porous, they easily would bring that bank there, and we have documented it in our study. That is the route, you know, where we get most of our bank, you know. If we look at Tanzania, the border there, you know, you can cultivate bank in Tanzania, but they don't encourage you to smoke it, so they bring it to Kenya. You see, yeah, they bring it to Kenya, and you find the bank coming, you know, to Kenya from
they
Tanzania.
Cook for us. Well, they don't eat. They cook for us, but
Yeah,
they don't
yeah. You grow it, but sell it to Kenyans, you know. So, and when you look at some of these, the illicits, especially the portables and so on, from Uganda, you get a lot of these sachets, you know. Sachets are illegal in Kenya, where you get beer which is packaged at anything lower than 250 grams. It's not, it's not legal in Kenya. But in Uganda, you can get the sachet, although now they are working on making sure that it is illegal. But there's still some people who are still, making sachets. And then they would bring it here, and and the beer in Uganda is cheap. So Kenyans across the border would cross to Uganda, take the beer, it's cheap, and then it come back to Kenya. The smugglers will get the cheap beer in Uganda, bring it to Kenya, and sell it at a lower price. And so you can see the challenge we are having. Even as we try to make the price of beer as high as possible, there are people who are working to circumvent, that kind of thing, and bring this cheaper, drinks and such, in the country.
And you believe maybe we should be doing a little bit better, because at the end of the day, exactly what we've talked about is something that has been there for a while. We know the routes that for the cannabis, and we know very well that for shisha we are still using it, despite the fact that the government outlawed it time and time again. And also we are experiencing the new trend in what we are having, more or less like the new technology in drugs and substance abuse in the country. What do you think, Doc?
So for me, I think the challenge is high, and all of us, we must be committed towards that. Because the new ones will continue coming, the use will continue. Why? Because the users are there. Those with the need to use are there. All right,
just a minute. It's about 5 minutes. I'm now going to be giving my panelists their closing remarks. We are talking about the issue of drugs and substance abuse in the country. And NACADA released a report that shows we are on the red. Doc, starting with you. What do we do? Because looking at 5 years ago, we were not in the same place that we are today, and we would wish to be back in those positions, because now a lot of things are going haywire when it comes to drug abuse in the country. When we even have to add prescription drugs, we have to have poly drugs. Now we have to have the new emerging ones, like what we talked about, the vapes and the shishas.
We need to go back to our roots when we discourage use of drugs by young ones. We need to go back to our roots when we look at the family interaction and family relationship and conducive environment where these children grow in. We need to look at our education systems that support our learners, that understand our learners, and provide good education environment that our learners don't start using because of the environment that they are facing in the school environment. We also need to look at our community. The community that supports the reduction, but not a community that is supporting the use. We need also to look at the treatment facilities. This is something we have not addressed. Treatment facilities that treat the abuse. This also requires to be looked into, because this is where you take one of your loved one, and after 3 months, will hit the door, go and drink the same day. Why? So we require to look at what is happening in these treatment models. And that's why for me, with my treatment at the Kizima mental wellness, I use family approach, which for me is working. Family approach, and it's working. We require to question what we have been doing in the past, in terms of treatment, in terms of campaign, in terms of running institutions where values are installed in our learners. We require to look at all this. We also require to look at how comes we have this surge of the drugs in the country. While we are saying there is no money, there is money to purchase drugs. There is huge business. And our young ones are yearning to use. And they are getting this money. Where are they getting this money from? From us. They are robbing us every day. They are robbing the parents. They are robbing the brothers and sisters. They are robbing the community. We require to go back to the roots and ask ourselves why and how do we address. Thank you.
Prof, wrap it up. And does NACADA have prosecution powers that it can take either drug barons in court?
No, not yet. We don't have such. As I said, we rely on the other government agencies to do that, and I think that is something to think about. But as we think about that, we also want to look at the regions. We cannot work in isolation, as you said. We need to look at the regions, as Ethiopia, Tanzania, so that we can have uniform laws and regulations. That is going to help a lot, because I talked about the sachets. You know, a 50 milliliter sachet is easy to conceal. The kid will easily conceal it, and it's cheap. So, you know, but if we talk of a minimum of 250 milliliter, you know, that means that it is expensive. First of all, you can't conceal it, and you know, and therefore, these are some of the things we should look at. Again, we also want to look at the local solutions to our local problem, and the treatment. The guy talked about treatment. You know, there's something called MAT, the medically assisted treatments, and the therapies. Such therapies are very expensive. We are using methadone, which we are getting from wherever. Why can't our scientists, why can't our researchers find a way of doing it? Must we always rely on this, whatever? We must look for local solutions to local problems. And I think this is very important. What were our forefathers doing? They must have been having same challenges, but they must have been doing something. So I think these are, you know, on a wider, you know, perspective, these are things to look at. But lastly, the community engagements. This war is going to be won at the community level, and that is where we should actually now concentrate.
Well said, Professor John Muteti, who is the acting CEO of NACADA, and Dr. Rose Kiiru, who is a psychologist and mental health expert. And we were looking at the drugs and substance use in the country. That's where we put a cap on that, but quite disturbing figures. 1 in every 6 Kenyans aged between 15 and 65, that is, we're talking about 4.7 million, are currently using at least one drug and substance of abuse. Of course, you can get this from the NACADA website, so that you may know exactly where we are as a country when it comes to the use and the usage of substances. Thank you indeed so much for watching. Let's continue this conversation on social media. My name is Njue. On behalf of everyone who has made this broadcast a success, I wish you a blessed afternoon. It's exactly 12. Thank you.